Community Health Worker Training, Cardiovascular Health and Diabetes, Module 6C, High Blood Cholesterol. Learning outcomes for this mini-module include list procedures for treating high blood cholesterol, explain lifestyle changes that affect cholesterol, and identify community health worker activities that create care connections for people at high risk for or with a history of high blood cholesterol. Treatment. Only 1 out of every 3 adults with high cholesterol has the condition under control, but people can take many steps to help manage their cholesterol levels and lower their risk for heart disease. And so how is high blood cholesterol treated? A heart-healthy diet. All of the things we talked about in the last mini modules. So eating foods low in saturated fats, trans fats, and cholesterol. Avoiding eating foods like snacks that come in packages that tend to have a lot of trans fats, right? Trans fat is the vegetable oil used to keep baked goods fresher in the store on the shelf, right? And for cooking food in restaurants and fast food places. And trans fat raises the level of triglycerides. Limiting the amount of saturated fat. So saturated fat found mainly in foods from animals has the greatest effect on raising blood cholesterol. Generally, someone's LDL or bad cholesterol begins to drop just a few weeks after they start eating healthier meals and snacks that are low in saturated fat, and once they start increasing their level of physical activity. Very important. So regular exercise in general is very important. Again, about 30 minutes, more or less, at least 5 times a week. So the goal is at least 150 minutes a week. And so even though this picture has women jogging, it doesn't even have to be that vigorous exercise, just moderate exercise levels. So really getting out and taking a walk at a good pace is a great place to start. Weight management. So trying to keep your weight at a normal level, or at least losing 10% of the body weight if the person is overweight, goes a long way toward helping to reduce cholesterol levels. Stop smoking, that's not on here, but if the person is a smoker, very important to help them stop smoking. And then finally, some people also need medication, and that's either because they can't do all of these lifestyle changes, or they do them and it's just not enough, and their cholesterol numbers are still too high. There's a number of different cholesterol lowering medicines that are available. The most common type that people are put on are statins. And statins lower LDL or bad cholesterol by slowing down the liver's production of cholesterol. Another category of cholesterol-lowering medicines are bile acid sequestrants, which help remove cholesterol from the bloodstream by removing bile acids. Niacin is a B vitamin that can improve all lipoprotein levels by raising the HDL, or good cholesterol level. And if you remember, HDL actually helps to remove LDL from the bloodstream. Fibrates are another category, and they slow down the liver's production of cholesterol, reduce triglycerides in the blood, and boost HDL, the good cholesterol. And they tend to be used for people who can't take statins, or who try to take them and have too many side effects. And finally, another class of cholesterol-lowering medicines is an injectable type of a medicine called PCSK9 inhibitors. And those lower cholesterol specifically for people with familial hypercholesterolemia. And that's a type of high blood cholesterol that is very high. It is genetic, it runs in families, and it usually doesn't respond as much to lifestyle changes as the other kind of more common high blood cholesterol problems do, right? So most people who have high cholesterol just have high cholesterol because of their diet or their lack of exercise. But for some people who have this genetic family hypercholesterolemia, they need more intensive treatment because their levels are much higher and don't respond to kind of the normal stuff. So take a minute and click on this link to watch this video that gives an overview of managing high blood cholesterol, and then come back to the PowerPoint.
If you've been told that you have high cholesterol, you're not alone. It's something that affects millions of Americans. There are many different risk factors that contribute to high cholesterol. Some of them you can't control, and others you can control. The American Heart Association recommends that you start with these 4 key lifestyle changes. 1. Eat a heart-healthy diet. Simply put, trim the fat. One of the best ways to lower your cholesterol is to reduce saturated fats. Try to limit things like red meats, fried foods, and full-fat dairy products, and load up on things like fruits and vegetables, poultry and fish, and foods that are high in fiber. 2. Get moving. Physical activity is a great way to increase your HDL, the good stuff, which helps to decrease your LDL, the bad stuff. Whether you're walking your dog, riding your bike, or swimming, getting aerobic exercise on a regular basis is a great way to keep your cholesterol in check. 3. Lose weight. Being overweight or obese tends to raise your LDL and lower your HDL. Just by losing 10% of your body weight, you can dramatically reduce your risk for high cholesterol. 4. If you're a smoker, stop smoking. If you have high cholesterol and you smoke, you're at an even higher risk for heart disease than non-smokers. Kicking the habit will not only improve your cholesterol, but it will reduce your risk for many other dangerous diseases. Unfortunately, there are some people who can't control their cholesterol just by making healthy lifestyle changes. There are a variety of reasons why, and among them is something known as familial hypercholesterolemia, or FH. FH is a genetic, inherited disease that results in increased levels of LDL. That's why it's a good idea to know about your family's cholesterol history. There's great news for people who can't control their cholesterol through lifestyle changes alone. Cholesterol-lowering drugs have been proven to be safe and effective in controlling cholesterol. If you need cholesterol medication, your healthcare provider can design a treatment plan that's right for you. By taking control of your cholesterol, you'll improve your long-term cardiovascular well-being, which will help you live a longer, healthier life. Taking the next step in managing your health is as easy as CCC. Check, change, and control your cholesterol. Get started now by visiting heart.org/cholesterol.
So what's the role of community health workers? What can you do to help people prevent high blood cholesterol? Teach community members to get cholesterol screening, right? So talk about the fact that high blood cholesterol is something that really can raise their risk of having coronary artery disease, heart attack, stroke in the future, and that if they have high cholesterol, they're not going to know it unless they get tested because there are no symptoms. So really encourage screening. Encourage people to make lifestyle choices to lower their cholesterol. So healthy diet, physical activity, healthy weight, and quit smoking. Help people choose a diet low in fat, low in saturated and trans fats in particular, and low in cholesterol. Encourage people to eat less fatty foods and to decrease the amount of fried foods that they eat. What about for people who are already diagnosed with high blood cholesterol? So really important to teach them that if they don't treat their high cholesterol, it will put them at risk for heart disease, heart attack, and stroke. So it's very important that they get treatment. All of the suggestions for prevention also apply to them. So all of the lifestyle changes and regular screening. They also need to understand the importance of regularly taking their cholesterol-lowering medicines, even if they feel fine, right? Their cholesterol could still be high, even though they're feeling fine, and damage could still be happening to their arteries. Help people who also have diabetes understand the importance of controlling their diabetes for their heart health, but also because uncontrolled diabetes raises their risk of high blood cholesterol and makes it harder to bring it down into a normal rate. And finally, you can refer clients to Rhode Island's Community Health Network programs. Now you can list procedures for treating high blood cholesterol, explain lifestyle changes that can affect cholesterol, and identify community health worker activities that create care connections for people at risk for or with histories of high blood cholesterol. Congratulations on completing Module 6. Don't forget to go to the Google Classroom to complete the assessment for Module 6, high blood cholesterol. The next module, number 7, is on diabetes and prediabetes.